The KUAM News Zoom room. The GDOE Superintendent Jon Fernandez issuing work from home orders for the Department of Education's employees this morning. John, this is rapidly evolving. I mean, things just turned around so quick.
I know.
Good morning. I mean, thank you for getting on the
Yeah.
show, too.
So
Well, I guess as a sign of how quickly things have changed, I think we've been on 3 times this week.
Right, I know. So when I
And
shot you,
it's-
I shot you the text. I was
So,
like, man, I hope you can come on. We got to get you a chair in here pretty soon.
right. Well, I mean, I think everyone should know, and because of last night, we wanted to put the information out there. I think earlier in the day, and you know how Guam is, you start to get these unofficial news circulating, and but the unofficial news I was getting was just really shocking to see that the numbers potentially jumping over any prior report that we'd seen. So I definitely had to make some calls to try to verify that the numbers were anywhere close, and what I was informed was obviously there were things in process, to get for the governor to prepare an announcement. And as part of that, we want to coordinate and collaborate with our other agencies, public health and the governor, but we know we needed to also get the word out to our employees at the same time, given the size of the organization and the fact that, if we don't do that, people start showing up, at school in the morning and so forth. So it was very important when the governor put her announcement out to also have made the decision that everybody, stay home and work from home, and we'll figure out, how to address the day and the week ahead while we're under this situation.
John, I gotta ask because so it's everybody, all of the teachers are still ordered to telework. Is that correct? They're still teleworking.
Well, right now, yeah. So
Be-
yes. So we do want to keep some of our operation going. And again, this was so quick and so fluid. So as of last Friday, I remember the discussion was, let's keep kids at home. And so our teachers and staff were reporting, and then through the week, the question was, well, are we able to also be flexible and telework with our with our employees? And we said, yes, let's get organized and work it out, and then we'll figure it out. But definitely that was the intention. But of course, now we have to go immediately into that mode. So it just shows you how quickly things have changed in the last week. So we're going to be, meeting with my leadership team and with the principals to kind of work through how we want to, how we can move forward. Because, I think the option for us is we got to figure out how to continue with our mission of educating our kids in light of this, these quickly changing circumstances.
Right. Now, I was just asking about the telework because, there may be teachers that are trying to actually prepare, for their families for this lockdown. And I'm not sure if you've gotten concerns or from some of your teachers about that.
Well, we are working and have to continue to work with our school community to really kind of set out the message that I want all of our employees to understand, which is number one, safety is the top concern, and it is a concern, and we are constantly monitoring the situation so we can address the safety issues. Second of all, we also have to think of our role as an organization and how we are going to operate to fulfill our mission. And then third, obviously everybody has their households and their families to take care of, and their kids who still are, need to attend school and so forth. So I think all I can say to describe the situation is it's fluid. We are, even though we are pushing ahead, we are not doing it with the same, under the same manner in which we did it last year and years before. We understand that we have to be flexible and fluid, but the message we have to our employees are, number one, be safe. Number two, let's see what we can do to continue with the services to our kids. And of course, that's not going to be perfect, given the fact that face-to-face and now home learning is almost out the door with some of the grab and learn distributions having to be canceled.
Right.
But we still have to, keep our focus and see what we can do, because it doesn't make sense to have, education start one week and then come back a month later, and then not know when we'll meet next. So we have to figure out how to provide some continuity and stability to what we're doing this year, and that's the work that's ahead of us.
But, the hard copy, it stopped today, the distribution. Can the hard copy students immediately jump into the remote learning?
If they would like to, yes, I mean, definitely. That is an option. I don't know how many of them will be able to make that shift so quickly, but again, we started off with 3 options. We're down to 1. We'll do our best to try to get everybody on that mode of learning. But there's a lot of work we also need to do with regard to the intended purchasing and deployment of further technology. So laptops being ordered, laptops being ordered, and other things that are coming in on their way.
Yeah, because we do have somebody asking about, can they switch from hard copy to online classes automatically?
I think they just need to be in contact with their schools, and we would love to facilitate that. Yes.
Okay.
John, we had another question here. Will 12-month employees get admin leave?
No, 12-month employees are teleworking still. So
Okay.
we just need to work through the details. I mean, I know we have so many different types of employees. So I'm sure there are going to be some who are going to question exactly what, that means for them. And we'll handle that on a case-by-case basis. But no one's on leave, technically. We're all supposed to be accessible, so we can continue to do what we can to continue the operations. But some of these things, as you know, will need to be sorted out, division by division, or employee category by employee category. So we plan to be fluid and adaptable this year, but we didn't realize how quickly that would be in the course of 7 days, especially during the first week of school. So, but again, the spirit is we are going to adapt. Let's keep looking forward and adjust. And that's a different type of mindset and leadership, capacity that we have to have in all of our schools and divisions.
So for now, the people that are on the hard copy, they contact the school today to figure out how they can transition into the remote learning, the digital learning.
Yes, correct.
Okay,
So
sorry.
we have a directory on our website for schools. You might have a hard time by phone. I mean, I know some of the schools are already forwarding the phones, but definitely there are emails. And of course, there are phones and email information for the central office as well. And we've been working to help our schools respond to parents.
Boy.
Oh boy.
There are some families that don't have internet access and or reliable internet too. The reality is that we have some families that don't have the resources. Is there anything you could say to that?
Well, that's exactly the concern and issue that we're going to be working on. Again, we anticipated that, and we had planned for different options for parents, and they chose which options. But we're back in PCOR 1, and we're back under some very severe restrictions. So the challenge that we have before us is to accelerate the work we've been planning on, trying to address those concerns and those needs. Things are taking time, but now we've got to just see what we can do to quicken the pace.
Okay.
How you doing, John?
Good. I just again, part of what I'm doing right now is obviously just really concerned about the community. What we've seen in our schools, I think we have about 9 positives. Right. I consider that about sort of the ripple effect of the prior weeks when we saw the cases rising. So there was always an expectation that we had 1 or 2 cases that would show up and we would deal with them, case by case. But now with the 105, it's a bigger concern.
Right. What people are saying in the comments is, thank God, we didn't open up the schools, right?
I wanted to ask about your nurses, your GDOE nurses. Right. We kind of were talking about the need that GMH is going to need more medical professionals. There's already a shortage. Is that the discussions that you have had, that the possibility of moving the GDOE nurses back to what they were doing before and helping out with containing COVID?
Well, we both have social workers and school nurses who are technically under the governor's executive order deployed for these purposes. And we've been in constant communication to determine how that would work during the school year. But right now, as we're shut down, I've been in contact with Director Artson Augustine to work on our I guess to work on determining exactly what the needs are so we can support and respond. So now that we're in this situation, I spoke to him or communicated with him yesterday, but I'm going to have to get an update from him today to figure out exactly what the needs are. And we're of course going to work with our governor and our sister agencies to do what we need to do.
And just for clarification, do the CDC guidelines require that a nurse be on campus? Because if you were to resume face to face, would that nurse need to be present on campus? Because if they're being used for at GMH or wherever they're being used at, wouldn't you have a shortage at DOE?
Yeah, it's a local mandate, for school health counselors at the schools.
Nurses,
And
nurses.
also, so there's a local mandate, and then also there, of course, the value of having healthcare, experts on campus to help guide some of the safety practices and help respond immediately when there are kids or employees who are exhibiting symptoms. That would be the benefit. So what we've been talking about in this situation, understanding that they might be needed to support the public health side, is looking at what joint response would look like in those situations. So knowing that, I think that the issue was we have to be able to plan around the needs at the schools as well as the needs in the broader community. So it's not simply a matter of deploying them to one or the other. It really is, what I say, I frame it as a joint response. How do we cover our bases when we deploy nurses? Do all of them need to go at once, or can we work on keeping coverage at the schools and just, cover multiple schools as needed while we support the public health efforts? Those are the details that we're working on. But again, joint response is kind of how I've been framing it, where we consider that if the schools are still in operation, we are going to need some support, but recognizing that the resources for the island safety are also going to be needed as well.
All right. Was there anything else you wanted to get out? We're going to go over to the hospital after this.
Yeah. Well, I just want to say to all of our stakeholders out there, please. I know I've asked for patience this first week. I'm going to ask for it again as we move into the second week with such different circumstances than when we first started. But the priority is, safety first. Let's just go ahead and please abide by the governor's executive order and the public health requirements. And then all the questions you have about school and whether it's our employees or our families, we'll work on answering those questions as we head into the next week. Right. Again, let that be your second priority. Your first priority, let's just try to get this island back into a safer public health situation. And I'm all for that. And I hope everybody will abide by those requirements faithfully.
All right. Thanks a lot.
Thanks, John.
Stay safe.
Yeah. All right, thank you.
Yeah.
Thank you all.
Praying for you and the family. Be
Okay.
safe. Wash your hands. All right. Okay. 8:56. Let's